Yes, this is an important situation where the other attenders of the family, they normally ask, uh, my mother had cancer and my father had cancer. Am I at an increased risk for cancer? The answer to this question is yes, there is an increased risk, but we need to understand that in a much more detailed fashion. So as of now, the science has evolved and studied few cancers in detail, few genetic or familial cancers in detail, but there are many more cancers which run in the family have to be studied in much more in detail. For example, there is a clear evidence of breast cancer and ovarian cancer running in the family. There is evidence of large intestinal cancers called colon cancers which run in the family, and a few more. So barring these other cancers, it is not very definitely clear. So the answer is yes, that individual has at an increased risk, but there is nothing to press the panic button. Like, it is always better to meet the physician, oncologist, and get it clarified what is that person's individual risk, or is there any tests which can be done to understand and identify the cancer at an early stage, if at all, if there is an increased risk. This is the next thing, that nobody in my family has had cancer. Am I risk-free from cancer? The answer is plain no. So every individual is at a certain level of risk for cancer. So they are called standard risk or normal risk for cancer. In my most of the speeches, I always come to the point that there are three factors which are responsible for cancer. One is genetic, one is environmental, the third one is lifestyle. One has no control over the genetic framework the individual receives from their parents or grandparents. One has no control over the air, what they breathe, that is environmental factors. But definitely one has a direct control about the lifestyle. So what determines one's risk apart from environmental and genetic factors is the lifestyle. As it has been very clear that leading a healthy lifestyle, like doing an exercise for 30 minutes, staying away from tobacco and alcohol, knowing that occupational risk hazards, there are some chemicals and other compounds which have direct association with cancer. So understanding these risk factors will reduce one's cancer. But then to say that nobody else has cancer in the family, that I as an individual will not get it, it is not entirely true. This is another important question. All the caretakers of the patient, they ask, does it spread to the other near and dear ones who are there? So the answer is a big no. So as I said, it's a disease which does not spread from one person to another person. It doesn't share by eating in the same plate or doing any other activity with them. So it is not at all contagious. This message has to be loud and clear. Many of them believe that if someone of their close is affected with cancer, they kind of try to keep them away, which is actually wrong, and it emotionally disturbs that affected patient. This is an important aspect. This is something which is day to day, which we do. Eating a healthy food is very, very important. Many of us believe that having a healthy lifestyle by eating good food and balanced nutritious diet is only good for heart and other organs like kidney. No, it is very important that the same healthy lifestyle also will help with cancer also. So in short, eating a balanced, nutritious food, like it is low in fat, controlled sugar diet. So this is a diet which is healthy for even cancer cells too. Indirectly, what happens is when you eat unhealthy food, like the food which is high in carb, high in fat, you put on weight, and then that results in obesity, and obesity has a direct link with cancer. So diet plays an important role, one in prevention. Definitely by leading a healthy, one of the most important components of a healthy lifestyle is diet, and diet prevents obesity. Good diet prevents obesity, so that has a direct link. Once you're detected with cancer, definitely continuous following of a healthy lifestyle, eating a good food and a good diet, it goes a long way in preventing recurrences and maintaining that continuous healthy lifestyle. Obesity is not directly linked to cancer, but there is an indirect association with cancer. So there is a high incidence of certain cancer in obese patients, like the breast cancers, the intestine cancers, what is called as the colon cancers, and the uterine cancers, otherwise called the endometrial cancers. So obesity has been linked to various cancers, but not all of them, but definitely to a major chunk of cancers. So as we know, obesity and diet and lifestyle are directly linked. So diet, lifestyle and obesity have an association with cancer.